Hello, welcome. My name is Ashley Chilla. I'm the Associate Director of Admission here at Emory School of Nursing. I am here with the wonderful, the amazing Dr. Meredith Farmer, who is the Program Director here for our Neonatal Nurse Practitioner Program. And this is the virtual open house for our Neonatal Nurse Practitioner Program. And I am going to hand this off to Dr. Farmer. We are recording this session. You will all get access to this recording after as well. Dr. Farmer, you can take it away.
Hi, thank you both for showing up and everyone who sees this as a recording. Thank you so much for taking your time to learn a little bit more about the neonatal nurse practitioner. I am Dr. Farmer. I am the program director of the neonatal nurse practitioner program. I am also a board certified neonatal nurse practitioner, shockingly enough, right? I've been in this role for about almost 2 years. I love teaching. I love my profession. I love being a neonatal nurse practitioner, and I love being able to share what I do with you all. And whether you choose this pathway or not, just know that I am here for you for any questions you have. You can always reach me via email at meredith.farmer@emory.edu. And I would be more than happy to talk with you. So now I'm going to share my screen. This is going to take me a minute, sorry. Okay, can everyone see my screen okay? Okay, perfect, thank you. So this is just a PowerPoint of basically what a neonatal nurse practitioner is, an overview of the program, and I actually have a slide also for if you happen to be an Pathway student, what your plan of study would look like, because it does look a little bit differently than some of the other specialties, because you do need to have some experience to become a NNP. I'm Dr. Farmer, like I said. I currently still practice as I am right now. I work at several different neonatal intensive care units throughout Georgia, Florida, and Virginia, which is a new one for me. I really enjoy that traveling to be able to see different ways that places practice, how they manage their babies. And I feel like this really gives me an advantage when it comes to your education, so I can not one way is the only way to practice medicine, basically. So my scholarship, I'm really focused on the neonatal nurse practitioner workforce and have written several publications, and I'm currently doing several studies about our workforce because, as we'll kind of talk about, we are very there are many jobs opening because we are a aging workforce, and we definitely need new people coming into our profession to keep our workforce growing. Along with that, we also have sicker babies and more babies being admitted to the neonatal intensive care unit just because of our increase in technology that we have. We are one of the newest specialties in medicine. We are the newest specialty in medicine. And because of that, our job is constantly evolving. I'm also working on some advocacy and then some role transition just for moving from an expert registered nurse to a novice neonatal nurse practitioner, because that does make a difference in when you're transitioning into practice. And then just some fun facts about me. I've ran 3 of those half marathons. No, 2 of them. I have 2 left, a full marathon in the next 3 months now. I do need to change that. So that's just a little bit about what I do outside of work. So, first, I'm going to talk a little bit about what a neonatal nurse practitioner is. So, we are advanced practice registered nurses, and what we do is we specialize in the care of high risk newborns. So, this includes those born prematurely down to 22 weeks gestational age, and then up to full term infants who are critically ill in the neonatal intensive care unit and need that intensive care medicine. And we're also credentialed up to the age of 2, which a lot of people aren't aware of. It is a Master's of Science in Nursing program currently, and we do get our board certification through the National Certification Corporation, which is, or what we call is the NCC. I'm trying to get my screen up. There we go. So our scope of practice, basically what we do, we are that inpatient provider for the most part. There's several different settings that we can work in, but I would say a majority of us do work in that hospital setting in an intensive care setting. So if you're interested in that intensive care medicine, this is a really good pathway for you. So we manage those acute neonates along with the chronic conditions of neonates. Preterm babies, they're not just small. They have a lot of different complications that can occur from becoming prematurely, and sometimes they're in the NICU for up to a year. Usually at that point, we do pass them off to the pediatric intensive care unit, but we're not just those. We're like adult ICU medicine. You're going to take care of patients for just, 24, 48 hours, and then they're going to ship them out to a step down unit. When you're in the NICU, these patients actually stay with us for their full hospital stay. We don't ever discharge them or, to a lower level of care. So one good thing about that is we have this great continuity with our patients. We really get to know their parents. So because we're not just caring for that neonate, we're also caring for their family as well, making sure that they have the resources that they need and the support that they need while they're going through the super difficult time of having their child in the neonatal intensive care and not being able to bring their baby home with them. So, so some of those things that we do specifically as our job is we do a lot of delivery room care. We are certified in advanced neonatal resuscitation. We can order and interpret diagnostic testing such as labs and radiology. We do our own diagnosis through not our ultrasound, sorry, our chest x-rays, our abdominal films, things like that. We do prescribe medications and treatments, and we really are a collaborative environment we have probably the best collaborative environment when it comes to becoming a nurse practitioner because we really work closely with our neonatologist as well as a multidisciplinary team such as the nurses, respiratory therapists, social work, and physical and occupational therapy because all of these different specialties are involved in our baby's care. So in the past requirement has always been that you've needed 2 years of neonatal nursing experience before you enter the program. That has changed a little bit, and that's what we'll kind of talk about in a little while. So I talked about the majority of us are in that intensive care hospital setting, but we don't just have to work there. We can also be only delivery room neonatal nurse practitioners. We can do transport. We can also work in outpatient clinics and those follow-up clinics who take care of the babies post-discharge. So I talked about a little bit of this already, but our primary job functions, we're going to be in the hospital for that initial stabilization and resuscitation of newborns. We're also going to be managing their day-to-day plans of care and their care plans. We, are very close with the families, updating the families, talking with them every day about how the medical care of their baby is going. But on there's kind of that nurse practitioner side of things, but we also, that's specific to neonates, we want to make sure that we're monitoring their growth and development because we do have to very closely look at their nutrition and every day make those changes to make sure they're adequately growing and that they're hitting their developmental milestones when they need to. So, and from the intensive care standpoint, we are able to intubate. We put in umbilical central lines. We do lumbar punctures, chest tubes, thoracentesis, paracentesis, pretty much any procedure that needs to be done on the patient, we have the ability to do that. So different types of jobs you can have as an NP. We have our NICU-based NMPs, which is a majority of us, but you can also, like I said, do transport, delivery room care, outpatient follow-up clinics. But even if you get to that point where you don't necessarily want to be in the clinical role, there's so many different things we can do at that standpoint too. You can be educators, you can be faculty, you can, educate the next generation of NMPs. You can do research. You can go on and further your education with your DNP or your PhD, and you can become a neonatal researcher because, like I said, we are one of the newest, or we are the newest field in medicine. So there's still tons of research being done all the time on our patients. And then you can also be in leadership and administrative roles. So this is our last year's job market kind of analysis that I did, but this is pretty current as well. We just haven't had our newest graduation, like 2025 numbers have not come out yet. But we have about 800 available NMP jobs across the United States, and we're currently these are available jobs. We're currently only graduating around 300 students per year, and that number has been dropping over the past 4 years. So this is 300 students across the entire United States that we're graduating. So there is an abundance of job possibilities. I've never once worried about finding a job, and I'm usually able to be pretty marketable because of my experience. A lot of people, I think, are afraid that being this specialized, it's difficult to find a job, but truthfully, it's not at all. If anything, I think me being specialized has been a asset to my career. Okay, so this is, I'm going to first talk a little bit about Emory's NMP program and what someone who already has a little bit of NICU experience can expect. And then in a little bit, we'll talk a little bit more about that MM pathway portion. This is actually one of my babies that I took care of, and this is him. Well, this was a couple of months ago, but these are babies. We do take care of babies this small. This is not something that, you just see in the textbook. We get to live this every day. This baby, his mom's wedding ring would fit around his wrist. So she would be able to slip that on, just kind of to give you an example of how small they actually are. So we are a MSM program. It's a combination of online coursework. All of our didactic material, all of our lectures are online. So we are super flexible. We do have in-person intensives though. What that means is once or twice a semester, depending on the semester, we are in at the Emory Nursing Learning Center for about 3 to 4 days. And we're doing simulation. Our ENLC, or the Nursing Learning Center, is beautiful. We have a state-of-the-art simulation lab. I could not be happier than being able to be in the sim lab there because of the experience that I can give the students. It's wonderful. It's probably my favorite part of this program. So we usually do that in the first 3 semesters, or the first 2 semesters that you're taking your neonatal specific courses will be on site twice a semester for about 3 days. Then in the summer, that semester is short, so we usually just do a 1 day for about 4 days, or a one time for about 4 days. And then your graduation semester, we usually do 1 to 2, depending on what we need to do. But you do have those dates well ahead of time. So you can plan, with your life, because I do encourage you to continue working through this program. I also really encourage, we have 2 plans of study. We have full-time and part-time. I really encourage the part-time plan of study because people have lives. They do have to continue working. And for the people who don't have a lot of NMP or neonatal experience, they are required to continue working. So because of that, the part-time option is really the best way to do this program. So here are the 2 plans of study. So okay, these are both the part-time plans of study. So I didn't even include the full-time. I do not have anyone doing the full-time plan of study within my cohort. The one person who is going to actually dropped down to do part-time. So the fall semester, if you start in the fall, this is going to be when you take advanced patho and advanced pharm. And then you have about 2 courses per semester. You're going to start your neonatal courses the next fall. So you have 3 semesters of just, I call them those like core in Masters of Science in Nursing courses that you need to take. And then after that, you're fully immersed in only neonatal courses. And then you can also start in the spring. And in the spring, you're going to, you do have one class kind of out of sequence with the other, but these are your 2 best plans, in my opinion. So some of our clinical rotation sites, we do go to Emory Midtown. We go to CHOA, which is now AMBH. We have other partner hospitals. We do ask that if you have connections, that you do help us with trying to identify a clinical partner, but we do work with you to make sure that you're able to find one. And then we also are in a variety of settings in the NICU or in the hospital setting. Okay, so for faculty and support, I am the program director. I am also the core course faculty, so I'll teach most of your neonatal courses. I do have one other faculty member who is hopefully going to be joining us that will also be helping. Okay, so for the MM pathway program requirements. So these are the students who are currently in the Emory MM pathway. If you know, you know. If you don't worry about it, type of thing. So in your spring semester, so I believe this is your 3rd semester, you're going to, in your fall semester, which would be right now, you would need to declare NMP as your specialty. In the spring, you're going to take a neonatal elective course, and we call it Neonatal Care 1. It's a 2 credit hour online course that does have just 1 day of simulation associated with it, where we're in the sim lab. I'm teaching you how to do those neonatal nursing type skills. And in the summer, we have the Neonatal Care 2 elective course that's also 2 credit hours, and we have 1 day of simulation during that course. So in these courses, I'm really teaching you that pathophysiology of the neonate that you do not learn in a pre-licensure program. Unfortunately, the pre-licensure programs have maternity and then they have well child. There's this gap in education for the neonates, and until had been a nurse for like 3 years, I didn't really know that this existed. I didn't know neonatology existed because it's not really talked about in your pre-licensure courses. Some of the other things that I do recommend if you want to become an NMP is to attempt to find an externship, a patient care tech position in a local NICU if possible. And then you'll need to request a NICU rotation as a part of your, I call it your preceptorship. I can never remember what you call it, but your practicum in the summer semester before graduation. And in the past year, everyone who wanted to be in NICU was able to be. And then I want you to start looking for a NICU RN job in the spring semester. And I say this because you're going to have to work coming out of school. And if you graduate in August, I want you to be able to, start working through your fellowship, your RN fellowship, like in September, October, if at all possible. And this way we can go ahead and, secure you a job so you can start with that next class. And I am really good about helping students find jobs. Everyone who wanted NICU, I was able to help most of them find positions in the NICU before they graduated. So after graduation, you're going to need to start working in a level 3 or 4 NICU. And what you'll do is then you'll start the NMP program in that spring semester in the part-time status. So you'll still be required to work full-time to start getting that experience, because to take your board certification, they want you to have 2 years of NICU nursing experience before you take your board. So this is after graduation. And the recommendation from our national organization is to have 2 years of clinical experience before you start your clinical part of your NMP program. Because I have integrated these 2 elective courses into your pre-licensure program, those are going to count toward some of that clinical RN experience that you would normally get. So that's how we're able to, move the timeline up so you don't have to wait as long to become an NMP or to go back to school. Um, let's see. I think that's really it with the MN Pathway program. If anyone has any more questions about it, you can just let me know, and I'm more than happy to talk with you about it. Okay. And does anybody have any questions?
I'm going to just put in the chat here Dr. Farmer's email in case you want to reach out directly about anything.
I saw the chat and I was like, oh, she's telling me I need to hurry, so I better rush through everything.
Nope. I just put the fall plan of study in there as well in case anyone wanted to see what that full-time fall plan of study looks like. All of the plans of study are available on our website as well under the NNP program under the MSN tab. So you can certainly go there, look at that, and you can download them as well if you want to keep them as PDFs.
Okay, so how does the MN pathway look? Do you mean
MSN pathway? Are you asking about just the general program for the MSN? Do you want to see the plan of study again, or are you talking about our MN pathway program? My guess is we might be getting a chat response.
right. So the MN Pathway program, this is a pre-licensure program. So this is if you're not a registered nurse yet. This is for people who already have their bachelor's degree in another field and they've decided to come back and become a nurse, and that they specifically want to be an advanced practice provider. So this is if you're not a nurse yet and you're interested in becoming a NMP or another type of nurse practitioner, and you already have your bachelor's degree in something else, the MN pathway is a great way for you to do that. So you are ending up with your master's in nursing. The neonatal nurse practitioner program, this is a MSN degree. So if you are already if you already have your bachelor's of science in nursing and you're working as a nurse, or if you're a new grad, we can talk and we can get you on a path to become a NMP, and that would be in the first kind of plan of study that I was talking about. The big thing is you would have to have 2 years of NICU nursing experience before you started clinical. So that doesn't mean before applying, that doesn't mean before starting some of those basic nurse practitioner courses that I talked about. So even if you're just now starting as a nurse in the NICU, you can really go ahead and apply, because by the time you would start the program, you'll end up having 2 years of experience before you um, get to the clinical part. Because, like I said, really part time is the best pathway to do this, just because of working in life and the busyness of all the courses. Oh, nice. So yeah, so if you are interested, I don't know where you're at, but if you're interested in becoming an NMP, one, we can talk separately and I can try to help you figure out how to transition, because I would need you to go to a NICU. It would need to be a level 3 or 4. I do sometimes take students from level 2 NICUs depending on their experience. What I would do though is I would go ahead and start getting as much care, like delivery room experience as you can, being that transition nurse if possible. Then also, try to transfer to your local NICU, and then you could truthfully go ahead and apply for the program. I would just need you to like have a NICU job before you applied. So to make sure, because just in case you were had a hard time finding one, because you would need to have that experience before you started into the NNP clinical portion. So I don't know if the people online can see this. So Matthew had just asked what the plan of study would look like if you were in another specialty in nursing, like mother baby, and then had 2.5 years of experience. And that's where I was talking about going ahead and transferring to the NICU and trying to get as much of that newborn experience as you could. Another question was, how long does it usually to take to sit for take your NCLEX? I feel like everyone, this year was a little bit of a misnomer because of some different things that happened, but usually September or October. Ashley, can you tell me what the date normally is that they have to have their?
It's usually October 1st for our MN pathway students, or those who are graduating in August. Certainly, if you're outside of Emory, you'll need to get your NICU experience before you would apply. But for our MN pathway students, we always require that you have you pass your NCLEX by October 1st, going into your post licensure.
And Matthew, please feel free to reach out if you have any additional questions about your specific, situation. I would love to talk with you about it and see what we can do if this is something you're interested in. Any other questions? Thank you so much for joining us. And for you, those of you online, just know that I am always available to talk with you. I would love to tell you more about what we do if you have any specific questions.
Yep. And for those who aren't with us right now, Dr. Farmer's email is meredith.farmer@emory.edu. The email address for the admissions office here, in case you have any admissions-based questions, is nursingquestions@emory.edu. We're more than happy to connect with you or connect you with Dr. Farmer if you have any additional questions as well. So thank you so much. Thank you very much, Dr. Farmer, and have a lovely day, everyone.
Thank you so much.